Once you've collimated to the size that you want, my central ray is at least 4 inches, probably more closer to 5, lower than the greater trochanter. But it's passing through the femoral neck on the affected side. Now, once I've done that, I'm going to raise my tube up so that I can see the alignment on the IR. Now what I want to do is place the IR so that the central ray, as you can see right here, is in the middle of my IR, and that my IR is perpendicular to the tube. Make sure the patient brings their elbow up and out of the way, so I'm going to ask you to bring your arm across and give yourself a hug. Great. Now there is definitely OID, but the patient is as far close to the edge of the table as we can get. How do we deal with the OID? We increase our SID, and we have a big distance here, so that will give us the a better image. I also want to place my marker anteriorly, so it will come out in the anterior portion or the soft tissue portion of the femur. I want to keep it away from the superior part where the pelvis is. Then what I'm going to do is I'm going to lower the tube back down to the middle of the femur, as you can see right here. The next step will be to raise the unaffected leg up out of the way. Make sure you have found something that you can put the unaffected leg up onto. Now I'm going to raise the unaffected leg up for the patient, bend the knee into a 90-degree angle, and bring whatever it is that you use to support the ankle on up. Now you do have to be aware that you don't want this part of the structure that's holding the leg up in the way. And when I open up my collimation here, you can see that the metal is not in the way. If I pull it up this way, now you can see the shadow of that metal. So be very careful to make sure that's out of the way. The femur of the unaffected leg needs to be at a 90-degree angle to the table. So what we have here is very good. Central ray is placed perfectly. My collimation is perfectly set. The height of the central ray is also perfect. We've already aligned it to the IR. We're ready to take our exposure.